The pressure on National Health Service (NHS) in England is on as Omicron cases continue to surge. But for now, restrictions in England are unchanged.
Further restrictions, I think people have also responded very sensibly by being cautious, by accessing testing and by doing other sensible things to help to keep the virus at bay, and we will continue to monitor the data and keep it under review.
British Prime Minister Boris Johnson warned that pressure on the NHS is going to be considerable for the next couple of weeks and maybe more.
I think we've got to recognise that the pressure on our NHS, on our hospitals, is going to be considerable in the course of the next couple of weeks and maybe more, because there's no question that Omicron continues to surge through the country.
1 in 15 people in England are affected with COVID, making a total of 1 million of the population to be isolated, an increase of 50% compared to the last 7 days. But unlike the previous waves, that's actually not the major cause for the pressure on the NHS. The cause is the staff shortages. Doctors and nurses are off with COVID, and as a result, not all patients can be discharged.
Most worried about the level of staff absences that they are seeing. That is putting real pressure on particular trusts. But clearly, we're still waiting to see if there are going to be large numbers of older people who are seriously ill with this variant, and that's why we're preparing for the worst but hoping for the best.
Schools across the UK are reopening this week. Children are back to school with masks on their faces and classes with open windows. The government aims to stop the spread of the virus at schools.
Thank goodness is very low risk to children, so I'm very wary. I will listen to what the government says, but I am very wary about imposing masks on children in schools because I worry about their well-being, their anxiety and their mental health, which has already suffered because of school closures during lockdown.
Education Minister says keeping classrooms open is a priority as COVID-19 caseload surges and fueled by Omicron. But children may face merged classes amid staff shortages.